depending on the type. If we look at spina bifida, and some of the numbers in the final paper you may notice will change a little bit. What we wanted to look was to see, did the birth prevalence of spina bifida decrease after folic acid fortification began? And this is encouraging. We can see that before folic acid fortification, the birth prevalence was almost 8.2 per 10,000, and after folic acid fortification, it was 5.6 per 10,000. So this is where you really have a great public health intervention that really makes a difference. For hydrocephalus, we looked at it, in infants, children, adults, and the elderly. It is most common in infants, a little bit less if you include children, 7.97 per 100,000, and then in the elderly it's much more common. There are different types of hydrocephalus. In children it tends to be the congenital types. If we look at the elderly, we are looking at often at the normal pressure hydrocephalus or obstructive hydrocephalus from a tumor. So again, you have to look at the tables and so on because they're very different data. We also wanted to look at Tourette syndrome and the tic disorders. This was one of the group of conditions we were interested to look at. More detail in the paper here, but overall, the best way to identify these patients, particularly because it affects children, is to do school-based studies, and where 1% of children are affected by Tourette syndrome, and 3% have some kind of transient tic disorder. So very common. And if we didn't have the school-based studies, our estimates would be much lower because sometimes these children, the parent, they may not seek medical attention or be brought to medical attention.